Welcome back, everyone, to the deep dive. Today, we are going to do a deep dive into something pretty big. How we understand nicotine use now way beyond cigarettes.
Absolutely.
So we have some fascinating research here and expert commentary, including a pretty thought-provoking piece from Internal and Emergency Medicine. Really, our goal here is to extract the key insights about these new ways people are using nicotine
Right.
and what that means for keeping people healthy and also for public policy. So ready to get into it.
I am, absolutely.
Okay, great. So to really understand where we are today, let's take a quick look back.
Yeah.
This piece we're looking at, it reminds us that people have been noticing these connections between what we're exposed to in our health for a long time.
Yeah.
I mean, you think about Percival Pott way back in 1775.
Oh, yeah.
Realizing chimney sweeps had higher rates of a specific type of cancer.
That's right.
Or William Bentall's work in the early 1900s on smokeless tobacco and oral cancer in India.
Yeah.
But when it comes to smoking, figuring out the harm took a really long time, didn't it?
It did. And the commentary, it highlights how even with this big increase in lung cancer in the UK in the early 20th century, it still took decades of investigation. And it wasn't until Dahl and Bradford Hill's groundbreaking work in 1950 and then this massive British doctor study that followed that the link between cigarette smoke and lung cancer became undeniably clear. And what's fascinating is that even with something that seems relatively straightforward, like smoking cigarettes, it required years of careful study to prove what was causing the problem. And then the Surgeon General's report in 1964 in the U.S. really solidified that understanding.
Exactly. And those early crucial studies often involved following huge numbers of people for decades, essentially waiting to see who got sick or passed away. Now, jump forward to today, and we're seeing all these new ways people are using nicotine.
Yeah.
You've got e-cigarettes or vapes, heated tobacco products, and then you have these nicotine pouches you just pop in your mouth. It's not as simple as just counting cigarette sales anymore, is it?
No, it's not. That's where it gets really interesting.
It does, yeah.
The commentary we're looking at emphasizes that studying these new generation products throws up challenges we simply didn't encounter with traditional smoking.
Yeah.
For one thing, how people use these products is much more varied. Someone might switch between vaping and using nicotine pouches, or even use both alongside the occasional cigarette.
Yeah.
They call this polyuse.
Yeah, polyuse.
Yeah. People also might use a particular product for a shorter time as they try to move away from cigarettes entirely.
Right.
This makes it much harder to track who's using what and for how long, which, of course, complicates understanding any long-term health effects of a single product.
Yeah.
Plus, there's a greater chance that people might not accurately report exactly what and how much they're using.
Right. Right. So those long-term studies that were so important in understanding the dangers of smoking, they're just not as practical or efficient for figuring out the impact of these newer products.
That's correct. We need something quicker.
Yeah.
Something that can give us answers in years, not decades.
Right.
That's what the commentary is pointing out.
It is. Okay. So that's where the discussion turns to the need for better kinds of studies, specifically using what are called biomarkers. So think of biomarkers of exposure as sort of biological breadcrumbs that tell us what substances someone's body has been in contact with.
Exactly.
So in this context, they can help us determine if someone has been using cigarettes, vapes, heated tobacco, or nicotine pouches. Organizations like Caresta and the FDA have even developed guidelines on how best to use these biomarkers in research. So if traditional studies take decades, are biomarkers potentially offering us a shortcut?
Potentially, yeah.
To understanding exposure?
They could?
Okay, that makes perfect sense, like having a chemical signature for different ways of using nicotine. But the article also mentions that these biomarkers aren't a perfect solution yet.
No.
What are some of the limitations we need to keep in mind?
So currently, it can be tricky to distinguish between someone who has been vaping heavily for a long time and someone who only started recently.
Okay.
Or even to tell if someone has completely stopped using nicotine products in the very recent past. Also, figuring out precisely how much of a particular product someone has used is still a challenge when relying solely on biomarkers.
Okay.
So the commentary makes it clear that we still need detailed information from people about their history and current use of all tobacco and nicotine products.
Right.
Think of biomarkers as one valuable piece of the puzzle. which needs to fit together with what people tell us
Yeah.
and what we've learned from other kinds of research, like studies looking at the toxicity of these products and how people behave when using them.
Okay, so biomarkers of exposure help us understand what people are using.
Yeah.
But what about getting a faster handle on potential harm?
Yeah.
The piece starts talking about biomarkers
Nice.
of potential harm in aging. It sounds like we're trying to get a sneak peek
Yeah.
at long-term health effects much sooner.
That's the core idea.
Okay.
Instead of waiting years for someone to develop a disease,
Right.
researchers are searching for biological signals, these biomarkers of potential harm, that could indicate an increased risk in a much shorter time frame.
Okay.
The fields of longevity and healthy aging have made significant strides in identifying biomarkers associated with the aging process itself.
Okay.
What's fascinating here is the potential to apply these in research on tobacco harm reduction.
Yeah.
For example, if a new product has a less negative impact on certain aging biomarkers compared to smoking,
Right.
that could be a strong early indication of reduced harm.
Yeah.
Imagine these biomarkers as early warning signs in the body,
Got it.
like slightly elevated markers of inflammation
Yeah.
that could suggest a potential problem down the line, even before a full-blown disease develops.
Okay. And the commentary also mentions something called intrinsic capacity as a way to assess potential quality of life benefits.
Yes.
What exactly does that refer to?
Intrinsic capacity is really about looking at the overall reserves
Okay.
of an individual, their combined physical and mental abilities at any given point.
Okay.
This includes things like how well their memory works, how mobile they are, their senses like hearing and vision, their overall energy levels, and their psychological well-being. Measuring these different aspects could give us a more complete picture of how switching to less harmful nicotine products might be improving someone's daily life, even if we don't see changes in long-term disease rates immediately. It's about measuring how well people are living, not just how long.
Got it. So this is getting incredibly detailed.
It is.
The article then touches on how advances in medical technology, things like imaging biomarkers and precision medicine, are playing a role.
Yeah.
How do these fit into understanding nicotine use?
Cutting-edge imaging techniques are becoming increasingly sophisticated,
Right.
allowing us to detect subtle changes in organs like the lungs much earlier than traditional methods. For instance, specialized lung imaging
Okay.
can potentially predict future health issues by looking at how efficiently the lungs are functioning. And the field of precision and predictive medicine, which aims to tailor health care to an individual's unique characteristics, holds significant promise for research in this area. By understanding someone's individual risk factors and how their body responds to different nicotine products, we can get a much clearer picture of the benefits and risks for different people.
Now, all this talk of biomarkers and advanced imaging, it sounds like we'd need a massive amount of data
We do.
to really draw meaningful conclusions. The commentary then emphasizes the importance of large cohort studies and sharing that data. Why is that so critical?
You're absolutely right. To have enough statistical power to really see meaningful differences, especially with these more complex patterns of use,
Right.
we need to study very large groups of people. Collaborating with existing large-scale studies, like the UK's Our Future Health, and linking that data with information in biobanks offers a fantastic opportunity.
Right.
These studies already collect a huge amount of health information, and by adding data on the use of new generation nicotine products and biomarkers, we can conduct much more robust analyses and rely less on people self-reporting alone.
And it doesn't stop there. The piece also brings up using genetic data
It does.
and machine learning in this research. That sounds like another level of complexity entirely.
It is, but it also provides incredibly powerful tools.
Okay.
Genome-wide association studies. Think of it like a massive detective hunt across our entire genetic code to see if certain genes are more common in people who react in a particular way to nicotine or who are more susceptible to certain health outcomes, can help us understand if there are genetic factors at play. And then there's Mendelian randomization, which uses naturally occurring genetic variations to try and separate out the specific effects of nicotine from all the other harmful stuff in cigarette smoke. Finally, machine learning allows us to analyze these enormous and complex data sets and potentially uncover patterns in things like quitting smoking, reducing use, and poly use that we might miss with traditional statistical methods.
So we're getting a much more detailed understanding
Yeah.
of who is using what
Yeah.
and the potential harms.
Yeah.
But the commentary also stresses the importance of focusing on specific groups
Right.
who are at particularly high risk.
Absolutely.
Who are they talking about?
The article points to a couple of key groups. First, heavy smokers,
Oh, okay.
especially older smokers, who are often the most addicted to cigarettes and the least likely to successfully quit.
Yeah.
The data mentioned shows that a significant portion of smokers consume a pack or more a day, and this is more common as people get older.
Right.
Second, individuals with major mental illnesses like schizophrenia and depression have much higher rates of smoking and much lower rates of quitting
Right.
compared to the general population.
Yeah.
The idea is that new generation products might offer more appealing and effective alternatives for these groups who have historically faced significant challenges in quitting smoking.
Now, we can't talk about new nicotine products without addressing the concerns about young people starting to use them.
Of course.
The gateway theory,
Right.
the idea that vaping acts as a stepping stone to cigarette smoking, is something we hear about a lot. What does this commentary have to say about that?
The commentary acknowledges the very real concern
Yeah.
about underage vaping
Right.
and the possibility of a gateway effect.
Right.
However, it highlights that major studies conducted in both the UK and the USA
Yeah.
have not, so far, provided strong evidence to support the gateway theory.
Okay.
That being said, the article is very clear
Yeah.
in emphasizing the critical importance
Right.
of preventing young people from accessing these products
Right.
due to the addictive nature of nicotine and its potential impact on adolescent brain development.
Yeah.
So while the broad gateway theory might not be holding up in the data,
Right.
protecting young people remains an absolute priority.
Okay. This all leads us to the idea of tobacco harm reduction, or THR. What's the current thinking on just how effective these new products are in helping people actually stop smoking cigarettes?
The evidence supporting the effectiveness of vapes in helping people quit smoking is steadily growing.
Okay.
The commentary references Cochrane reviews,
Yeah.
which are really considered the gold standard for reliable evidence in healthcare.
Right.
And these reviews indicate that vapes can lead to higher rates of quitting and switching completely from cigarettes compared to traditional nicotine replacement therapies like patches and gum.
Right.
However, the article also points out that we still need more research to fully understand how effective oral nicotine pouches and heated tobacco products are for smoking cessation.
It sounds like the science is progressing.
It is.
But the commentary also touches on the attitudes of doctors
Right.
and the potential need for medically licensed products.
Yeah.
What's the disconnect we're seeing there?
There appears to be a significant level of skepticism and even some misinformation
Okay.
among many physicians
Yeah.
regarding the relative safety of nicotine itself
Okay.
and the potential of THR products to help their patients. International surveys have shown that a lot of doctors don't routinely discuss THR options with patients who smoke, often focusing solely on complete abstinence from all nicotine.
Yeah.
A common misunderstanding is that nicotine itself is a major cause of cancer.
Right.
This skepticism can be a real barrier to the wider adoption of THR strategies in clinical practice. The commentary suggests that if tobacco and pharmaceutical companies invested in developing medically licensed THR products, products that have gone through rigorous testing and regulatory approval, it could help to build greater confidence among healthcare professionals and provide more viable options for smokers who struggle to quit traditional cigarettes.
This brings up a really interesting point. We've been so focused for so long on the harms of smoking that we might have unintentionally overlooked potential benefits of nicotine itself, separate from the dangers of burning tobacco.
Right.
The commentary touches on this, mentioning potential links to lower rates of Parkinson's disease
Yes.
and even improved cognitive function in certain areas. That's quite surprising.
It is, and it's definitely an area where our understanding is still developing.
Okay.
The commentary mentions the long-running British doctor study, which notably found lower rates of Parkinson's disease deaths among the heaviest smokers, with the study authors suggesting nicotine as a likely contributing factor.
Okay.
Major reviews of the research have also indicated an inverse relationship between nicotine use and conditions like Parkinson's and cognitive decline.
Yeah.
Some studies have even explored whether administering nicotine in controlled ways could help improve cognitive function
Oh, wow.
in individuals with Alzheimer's and Parkinson's.
Okay.
However, and this is crucial,
Yeah.
as the article emphasizes, nicotine is not without its own risks. It can cause a temporary narrowing of blood vessels and increase heart rate, and we still need more research on its long-term effects on the cardiovascular system and reproductive health, particularly in people with pre-existing conditions.
Okay.
But the key takeaway here is that nicotine itself is not what causes cancer. The vast majority of harm comes from the combustion products in cigarette smoke. The long-standing association of nicotine with smoking has certainly made it harder to research
Right.
and for the public to understand its potential benefit. And these new, cleaner delivery methods could really change that landscape.
Finally, the commentary highlights the importance of bringing all the different players together.
Yes.
The industry, academic researchers, public health organizations, through initiatives like the Morven Dialogues.
Yes.
What's the main goal of this kind of collaboration?
The Morven Dialogues are essentially an effort to build more open and transparent communication
Okay.
and research partnerships in the field of tobacco and nicotine.
Yeah.
The core principles that have been agreed upon emphasize the responsibility of manufacturers to conduct high-quality scientific research,
Right.
the importance of transparency in that research and in sharing the data,
Okay.
and a shared commitment to prioritizing the development and promotion of lower-risk products.
Okay.
What's particularly interesting is the recognition that while tobacco companies historically suppress data on the harms of smoking,
Yeah.
they may have also suppressed insights into any potential benefits
Right.
of nicotine. The commentary also addresses a significant challenge.
Yeah.
The fact that some prominent scientific journals
Right.
have policies that make it difficult or impossible
Yeah.
to publish research that has any funding or ties to the tobacco industry. The Morven Dialogues argue that perhaps reconsidering this stance, while maintaining full transparency about any industry involvement,
Yeah.
could actually lead to more rigorous and publicly scrutinized research in this complex area.
Yeah.
The fundamental idea is that by working together with clear safeguards and a commitment to transparency,
Right.
we can potentially accelerate progress
Yeah.
in reducing the harms caused by smoking.
So to recap, this deep dive into the latest thinking on nicotine products really shows us that we need to change how we approach research.
Absolutely.
We can't just rely
Yeah.
on those decades-long studies of the past.
Yeah.
We need to embrace new tools like biomarkers, harness the power of big data and machine learning,
Yeah.
and really focus on the specific needs of those who are most vulnerable to the harms of smoking. Tobacco harm reduction holds significant promise.
It does.
But we need to address the skepticism among healthcare professionals and carefully consider both the potential risks
Yes.
and the emerging potential benefits of nicotine itself.
Absolutely.
Yeah.
And fostering open collaboration and transparent research among all stakeholders is going to be essential if we want to make real progress in this rapidly evolving field.
And that brings us to our final thought for you.
Okay.
Given our long and complicated history with nicotine and the growing body of science around its effects, how might a more open and collaborative approach to research reshape not only how we help people quit smoking, but also how we think about health and well-being as our populations age?
It's definitely something to consider.
It is something to consider.
Yeah.
Thanks for taking this deep dive with us.
My pleasure.
All right, we'll see you all next time.
See you later.